I'm here with Dr. Robert Hunsaker, who is a board-certified surgeon with over 25 years experience, almost 30, correct, doctor?
That's pretty close.
I wanted to know a little bit about your experience, your education. How did you start?
Well, in terms of plastic surgery and cosmetic surgery, we have preliminary training, so you go to medical school and do your general surgery training. I did all of that. And I wanted to come to Miami and train specifically at the University of Miami, but they didn't have room for me that year.
Okay.
So I arranged to do a special fellowship in England for almost 2 years, which was a tremendous volume of surgery and a wide variety of cases, which really set me up for a great experience here because, as Dr. Millard, my chief, said, I don't have to teach you how to operate, I'll just teach you how to be a better plastic surgeon. And so after that, I stayed on at the university for about almost 5 years. And in my early days, my early practice, it was a mix of reconstructive and cosmetic, and kind of a natural evolution was to go into exclusively cosmetic surgery. And so for over 15 years, it's been exclusively cosmetic surgery.
So I'm going to take you off track a little bit of the cosmetic surgery stuff, but I heard that you played college football.
Well, I did.
You did?
I did indeed. Yeah, I played for a very small school in Ohio called Wittenberg University.
Very nice.
Small liberal arts school, and maybe 2,000 students, maybe fewer students than Southridge High School in Miami, I'm not sure. But we did win a national championship while I was playing. They've won 6 over all their time, but we did win one.
Very nice. You mentioned that the other day that you have a very prestigious position at the University of Miami. Can you tell us about that?
Well, you can judge how prestigious it is yourself. You can be the judge of that. But when I finished my training, I was asked to be the Associate Chief of Plastic Surgery for the University of Miami at Jackson Memorial Hospital. And so I was full-time faculty for that. I was ultimately the director of the residency training program, so I was in charge of training, supervising and training the residents there for the duration of the time that I was at the university.
And we have a lot of questions from our friends on Instagram, and
sure.
If you don't mind, I'm going to read a few of them.
Okay.
So this one is from Little Christian, and she says, I'm 4'10", 105 pounds, and I wanted to get breast augmentation. I want it to look natural. Any recommendations?
Well, the recommendation is pretty much the same for all of our patients, and it's best to actually bring or show us a picture or pictures of somebody who has the same proportions that you're looking for on your body. It really doesn't matter what implant they had, how tall they are, because if you're looking at a mirror from your belly button to your collarbone, we can figure out what dimensions of implant we need in your body to give you that same look. And most importantly, everybody's idea of the word natural and proportion is wildly different. You only have to be here about 1 week to fully understand that.
That is very true. It's very subjective. I have one here from Amalia 319, and she asks, can scars after breast lift surgery be fixed?
Well, it does depend what the problem is with the scars. When we operate, scars are permanent. I mean, even great scars are there and they're permanent. The question you ask yourself with scars is, can I as a surgeon control any of the factors that we need to control in wound healing better this time than maybe they were controlled the first time so that I can expect to get a different result? Sometimes, and most of the time, frankly, it's simply genetics. I mean, the most important part of scar formation is genetics. Our job is to give your body the best opportunity to make the best quality scar that you're genetically capable of making. And if we've controlled all the things we can control and you make a poor scar, there may be things we can do to help. Topical treatments or injections or laser treatment, but there is some limitation.
XOXO Marie, and she's asking why certain people's breast implants are so spread apart, and is there a way to fix it?
Well, that's a pretty good question because patients often bring that up to us when they tell us what they don't want with the results of their surgery. Part of that is dependent on your natural anatomy. Some people's breasts actually touch before surgery, which is also a problem for us. Or sometimes they're just widely separated with a very narrow diameter of their breast, which gives us some limitation on how close we can make the cleavage. But another part of that is in our hands, and that's how we dissect the space where the implant is going to be. Now, can you fix it? Well, it kind of depends whether it's an issue with the anatomy or an issue with the pocket space. Most of the time, especially if they're really widely spaced, the answer would be yes, we have techniques that we can offer that can improve that.
Talking about pocket space, I heard that you were a popular surgeon with transgenders.
Okay.
And I heard that the male physique doesn't have pockets. So you have to redesign. Can you explain a little bit?
Well, the anatomy is a little different,
Mm-hmm.
so it's a little harder.
Mm-hmm.
Because the way the muscle starts from your rib cage.
Mm-hmm.
They tend to have more attachment to the ribs. They tend to have thicker, stronger muscle, generally. And a really important factor is the distance from the nipple to the fold under the breast, because that's where the implant sits, is right on the fold, is quite short in some patients. You see a male bodybuilder, his nipples aren't up in the middle of his breast, they're down close to the cut of the bottom of his breast. And so those offer some challenges in how to size the patient. It does stretch over time, so we have techniques to deal with this. But it absolutely is a different operation. It requires some experience to really have predictable results.
I have one last question for you,
Sure.
and this one is from Malison. And she is asking if there is a patient weight requirement for breast augmentation.
You have to weigh. The weight requirements, so to speak, in surgery is mainly an anesthetic issue. Okay, and there's some other issues with blood clot risk and healing risk and things like that. And generally, it's around 34 to 36 BMI. It's not actual weight. It's the body mass index. But I also evaluate the patients individually because some people carry a lot of weight in their hips and their thighs and not so much on their trunk. And they can be heavier and have higher BMIs because that weight isn't particularly affecting our anesthesia concerns and our healing concerns here and that sort of thing.
Well, thank you so much,
All right.
Dr.
No problem at
Hunsaker.
all.
It's a
All
pleasure
right.
interviewing you. You guys will be able to see more of Dr. Hunsaker in our Instagram. So follow us, follow him, we're tagging him, and we'll see you soon.
See you soon.
So you guys know what to do. Subscribe to our YouTube channel. Follow us right now. Write us questions, whatever you need. Comment, like, and follow us. You'll see us every day.